ladies and gentlemen, to another exciting episode of the Clean Talk. Today, we are going to discuss a very important topic that comes to mind when we're talking about healthcare. How important is PPE, that is personal protective equipment inside a healthcare facility, especially a hospital? To shine a light on this topic, joining us today is Ms. Caroline Bilen, founder and CEO of the Campus Health Consultancy. Welcome to this episode of the Clean Talk, Caroline.
Thank you so much for having me today.
There's a lot that our audience can learn from you today, but let me start with a very simple question. How would the absence of PPE impact the spread of infections in a hospital setting?
As you know, PPE are specialized clothes and equipment designed to protect people from any hazard in the workplace or environment, right? And we're talking about the gloves, masks, respirators. So imagine these PPE are like a barrier to protect the person from any hazard that can increase risk of injuries, illnesses, of diseases. So imagine that the people or the healthcare people are working in a hospital without PPE. What will happen? You know, like you are sending people to a war without equipments. So the PPE works as a shield to protect them, give them confidence to fight the battle. So what will happen without PPE? Definitely we'll have a lot of things like increasing hospital-acquired infection, you know, and this is due to cross-contamination from patient to patient, from the healthcare workers to another one. And this lead to complication to the patients, complication to the hospitals, and complication to the healthcare workers. And we're talking about outbreak due to the spread of the infection. You know, when we have infection, we need to contain it, and we contain it with the measurement, including using a PPE. So without PPE, we are exposing the healthcare, the patients to a risk, and definitely can lead to a harm to the patient.
Now, since you touched upon a very important point about the safety of healthcare workers, so what exactly are the risks if they don't use proper PPE?
First of all, they are the front line, right? They are the one who's taking care of the patients. So if they are contaminated and getting the infection, they will transfer the infection to the patient, and they will transfer the infection to the healthcare workers, their colleagues, to the community, to the family. So they will be source of contamination. And not only that, once you have the healthcare workers sick, definitely, with the case where we have outbreak, we have shortage of nurses. So who will be taking care of the patients? So the person who is sick, he needs to be in a quarantine to be treated, right? So there is a lot of load of the other staff working. And during the COVID pandemic, we have seen the burns syndrome of the nurses and the stress that really was so high. And this is where we need to start by protecting our healthcare providers, because they are the front line when it comes to any outbreak or disease in a hospital.
Definitely. And moving on to our next question, how would the lack of PPE impact the overall functioning of a hospital?
You know, when we have increasing infections, we need to increase the capacity of the hospitals. And during the outbreak or infection, the capacity of the hospitals really needs to contain all these patients, right? And this is overwhelmed the hospitals. And this means that we'll have wards full of patients. When you have wards full of patients, that can lead to delay of the treatment, because you don't have nurses as well to take care of the patients. So delay of the surgeries. Really, it will affect all the process from having the patient treated well, having the healthcare protected. I think we are in an era to prevent illnesses. So imagine that you are in hospital already, you are causing harm to the patient, and this will increase the risk and cost to the hospital.
Definitely it will. And let's talk about legal and ethical implications of not using proper PPE. Are there any?
Oh, definitely. You know, there is a global health regulations coming from OSHA, from CDC, WHO, that hospitals, they must have the right PPE. They should have policies. They should have a training to provide the PPE to protect the healthcare providers and the patients. It's part of the regulations. So if you don't have it, ethically, they are breaching the compliance for safety, and can put them in a lawsuit, compensation, because patients in the hospital get contaminated, the healthcare get contaminated. And remember, hospitals should not do harm. This is what Florence Nightingale said, right? So if we don't protect our patients and the healthcare, so we're doing harm. And this is the hospital losing their reputation. They will be fined. They will be paying compensation. And I think this is all will be overwhelmed to a hospital. Sometimes can close the hospitals as well.
Definitely. Now, we understand the importance of using PPE, but at the same time, let's also discuss how to properly, dose off the PPE. How do you don the PPE?
It is part, again, of the regulations that you need to have the proper PPE, and you continuously train the healthcare provider in the hospital. Training is very important because you can get the best PPE, but if the people, they don't know how to use the PPE in a proper way, you're not protecting them, and you're not protecting the patients. So hospitals, they are doing training to the healthcare providers continuously to make sure that really they are doing the right things. This is to start with. Training or transfer the knowledge is something, but the implementing the right PPE in a proper way, this is another concern, because you have shortage of people who does the training. You cannot stay in front of everyone and see if he does the training or does the application properly. And this is where we have the AI technologies nowadays, and really it's really adding value to the healthcare transformation. And we have the Blue Mirror, like the only PPE training provider so far, to ensure that we are using the policy procedure of a hospital, trained on how to apply it. If they did a mistake, we know how to correct the mistake, and the person knows what is the mistake. So it's important to know that training, it is mandatory. Plus, the donning and doffing PPE is very important. There is a process starting from hand hygiene, which is, I always talk about hand hygiene. You need to wash your hands. Think about your safety, your family's safety, your patient's safety. And then you wear the gown, and then after you wear the gown, you are wearing the mask. You are wearing the mask, and then you wear the goggle, and then after that, you put your gloves. And then after that, what you need to do, you need to remove it. And it's very important how you remove it, because you already work with your PPE, right? Yeah. So you get the contamination. So I want to remove it in a proper way, in a good aseptic technique, that I don't contaminate myself as I'm removing, right? Starting from the gloves, from the gown, from the goggle, and definitely from the mask. And you wash your hands between that. And this is where you ensure that whatever you remove, you're putting in the right container, because if they are contaminated, we need to treat it differently from a non-contaminated item.
Now, before we conclude this episode, Caroline, I have to ask you, are there any historical examples or recent examples where the lack of PPE led to a significant health crisis?
We cannot forget the COVID-19 pandemic, right?
Yes.
COVID-19 was I think we still remember it, because the burden was high. When we started the pandemic, we have a shortage of PPE, because people, they were using PPE. Some of them use it properly, some of them, they were scared. And this is, lack of the PPE increased the risk, increased mortality, morbidity, stress of the healthcare providers, shortage of nurses. And we have, like in Ebola 2014, 2016 in West Africa, again, the same issues. We have the SARS 2002, 2003. So when we talk about outbreak, PPE is the right tools that can really contain that outbreak to protect healthcare provider and the patients. And if you don't have the right PPE or shortage of PPE, healthcare providers and the patient should be informed, because they need to take as well their own measurement in front of any outbreak. So this is really a big responsibility, not having the PPE and fighting any outbreak.
Definitely it is. And with that, we conclude this episode. Thank you so much for being with us, Caroline.
Thank you so much for having me.
And to our listeners, if you like this episode, don't forget to give us a thumbs up and spread the word. Until next time, thank you.